All righty. So public comments. Luce, any public comments?
No public comment.
Okay, that's always good. So we can have a review of the minutes from May 8th. I'll give everybody a chance to kind of take a look at them. And when you're done, I will entertain a motion to accept them.
I'll make a motion to accept the May 8th meeting
Thank,
minutes.
thank you, Allison. And a second?
I'll second.
Thank you, Glenn. And all those in favor
Sure,
say
second.
aye. Terrific. All right. Thank you. So
Aye.
we're all set on the minutes. Now, a review of May Health Department activities. Luce, anywhere you want to start is
Sure.
great.
We continue to meet with the region for our grant funding for the immunization media campaign. We paid the company, we made one payment so far, and they're in the process of beginning that. We've all met to discuss, our likes, dislikes, but I think everybody's going to be pleased with that. I'll let you know when that actually goes live with the web page and all of that. We celebrated Nurses Week, May 6th through the 12th. It was kind of a slow month. We worked on just spending a lot of our line items down, our budget down for the end of the year, getting ready for that. We participated in a tabletop exercise,
Yeah, I saw that.
local dispensing area.
What was the emergency?
It was a foodborne outbreak.
Okay.
And then I just included some things on the bottom of my notes about the 2023 Forces of Change survey that was released by NACHO, the National Association of County and City Health Officials. Just some key findings about, loss of public health staff, budget cuts, that type of thing as a result of COVID.
Yeah, I saw that. I mean,
that was interesting.
Well, yeah, not only interesting, but probably, well, bad judgment, because I mean, it's not like COVID has really gone away.
Right.
And we have, you still have surveillance, you've still got a lot of added work ever since COVID. So, truthfully, that is unfortunate. 20% of the local health departments are expecting further cuts over and above the ones that have already happened in 22 and 23. So that I thought was unfortunate. Let's put it that way.
I know we had talked last meeting about the last time we administered a COVID vaccine. So
yeah.
August of 2023.
Okay.
That was the last one.
Okay.
So it's been quite a while.
Yeah.
We had another meeting with the state regarding monkeypox, which they call mpox.
Yeah.
We had 6 cases in April in Connecticut. And then, more on that, the bird flu, just how there's been another there's a case of it in Michigan, another case in Michigan. It was the fourth ever in the US and the second human case of bird flu. But they're still, they're still watching it, just saying to all of the people that work with poultry and cattle just to use PPE, take precautions, but nothing, we keep getting the same information that there's nothing really right now that they consider to be high risk for humans.
Okay.
But they're just continuing to monitor that.
Okay.
Let's see. We talked about that. Sue participated in a West Hartford Bloomfield Health District measles tabletop exercise. That was on May 10th.
Oh, okay.
They also did some training for the incident command system. So if there's ever an emergency, it trains us on, who would be the safety coordinator and who would be in charge of communication. So those are some trainings that FEMA requires certain people to have. So they got retrained on that.
Okay. And what was the incident for the measles?
The measles was just a tabletop exercise.
Yeah, and they just said, so the event was just a school or a...
Yeah, it's a scenario where there's measles and everybody kind of comes together to figure out, all of our roles and ideas and what we would do if that should happen in our town.
Okay, thank you.
Let's see. They also participated in the American Red Cross Volunteer Education Training, an EMS open house, and we did giveaways to children and families who attended. They've been busy planning our summer day camp, which is going to be held on June 18th at Twin Brooks. They developed some forms for families who have children so they could get volunteer hours if need be to volunteer at those camps. So we've got a few volunteers to help out with that.
This is sort of an aside, but at what age do they start that in town that children need to have volunteer hours?
Oh, in town, I don't know off the top. Yeah, I don't.
Allison, off the top of do your kids need to do it yet?
They don't, but I know sometimes for maybe like for religious sacraments. I think so. If what is it? Your confirmation's like 8th or 9th grade, so I know.
Yeah.
I would say I think middle school. Some kids get some hours
probably
too.
Starting. Yeah, yeah.
Let's see. They also are partnering with the Nature Center and the Historical Society to conduct a nature walk through Twin Brooks on June 1st. They did that already. That's right. I keep forgetting, right, June. Okay. As far as cases of disease, we had 11 Hep B. Sorry. 11 Hep B,
yeah, 10, I saw that.
10 influenza. I'm just looking at the numbers that kind of stand out. We administered 20 vaccines. We had processed 27 ticks. 3 were positive for Lyme, 3 for anaplasmosis, and 3 for babesiosis.
Wow.
And then Sam also at I believe it was the EMS open house, she did more the Narcan training. So 6 more were trained in that. Then we've been busy. Sam especially has been dealing with another active TB patient.
Oh.
So that's just, we completed one follow-up. Now we have another one, which it's a lot of follow-up, a lot of monitoring, making sure that, we have negative sputums, they're on their medications. So,
Yeah, it's a lot. Do we know where the person got it from? Do we know what the contact?
no. It could have been late. It's probably most likely latent, and then it just the
Okay.
doctor caught it. So I mean, we can't say, where it came from.
Yeah.
So that's been keeping her very busy. We did have one hearing for a restaurant because they have been having a lot of issues and a couple of failures. So they came in to discuss follow up and how they're going to go about correcting these items. So our sanitarians met and took care of that.
So do they close during the time that you're having the hearings, or?
No, so they, whatever items failed, or I shouldn't say failed, whatever were severe risk factors are either corrected on site. If it can't be corrected, they'll go back in 2 days or a week, depending on what it is. And, the problem was that the same things kept being cited, or new risk factors were being cited. So we just thought it would be the best idea just to bring them in and sit them down and have a discussion with them about it so that they're aware of the severity, and we have some sort of plan in place as to how they're going to have better systems in place to, deal with those issues.
Oh, so in all my time that I've been doing this is the first time that I think there's ever been a hearing. So clearly this was pretty significant.
Oh, really? Okay.
Yeah, I don't remember.
Yeah, it's significant, but
Yeah.
it's usually the process. A lot of, health departments hold hearings if they can't get compliance, or if they feel that there's an issue that they're not really understanding. Just to get the owners in and not necessarily the people that are working that you might get at the time of the inspection, so that they can provide them with more education and training.
That makes sense, because they may not be on site when the visit's taking place. So you're telling the staff, but okay, that makes sense to me. Okay, wow. So what do you do for follow-up after the hearing?
So they'll go out and conduct more inspections, just make sure that they're in compliance.
Okay.
And then if it continues, and they get a failure fee every time, or re-inspection fee every time the inspector has to go out there, which is $100.
Wow.
So, if they go out again and we continue to see the same problem, then we can have them close. But so far we've been getting compliance with them. So luckily we haven't had to do to go beyond, the hearing.
Okay. Wow. Okay. Well, that's pretty significant. That's the first time that I remember that happening since I've been on the board. Okay.
And then they've been busy with the farmers market, which is going well.
Yeah.
Processing a lot of the temporary food events that are coming up, like Trumbull Day and all these other festivals.
So you'll be on site on Trumbull Day? Someone will be on site during Trumbull Day, or just you go out?
Maybe, maybe not. We have one person that's out on maternity leave, and it depends.
Okay.
I'm not sure if somebody will be there. But they review all of the paperwork with them beforehand. And a lot of these places are establishments or vendors that have been operating for a long time. The other part to it, it's usually held on a day where a lot of people have plans and things going on. So it's hard to get someone to go out there on, July 3rd or whatever.
Yeah.
Don't really think I have anything else.
So I see there was 3 letters of complaint and 9 phone calls of complaint for environmental health.
Mhm.
So those, obviously, you had to follow up on all of those.
Yeah, we always put those on the form. Those are just complaints that we get, whether it's septic complaint, someone's not washing their hands in the restaurant. It could be a variety of things.
Okay.
And then they just sometimes they'll issue letters, if need be.
Okay. Oh, and I see the hearing what restaurant that was. Okay.
Right.
Yeah. A lot of food inspections. So it's nice to have your sanitarians so that you can get you're really up and running on all of those.
Right.
Yeah. And the pool, those 10 pool are town pools, obviously, now that Memorial Day and getting those up and running, I guess.
Yeah, pool inspections are all the public pools, so condos.
Oh, well, the
pools.
condos. I hadn't thought of that. Okay.
Right.
Okay. Okay. And I guess obviously we do still have people in town with septic tanks. Obviously, they're obvious. And
Oh yeah.
yeah. Tobacco. I know there were some changes now that I think you talked about those a couple of meetings ago. That there's more teeth now in if they're sold underage. Now the police can. It's not just a fine, but if they go a second.
Well, they didn't pass that.
Oh,
That
they
legislation didn't pass,
Oh.
as far as I know now.
Oh, that's too
yeah.
bad. Okay.
Yeah.
Okay, so it didn't pass. I wonder why. Any ideas? Why? Yeah.
Probably political.
Yeah, I'm sure. I'm sure. Okay.
Yeah.
Okay. Anything else then on your director report or the activity report that you'd like to bring forward?
Oh, and then the sanitarians have been collecting the water samples from the lakes in town.
Yeah.
And in the past, we had someone who was in charge of the lakes were taking the samples and dropping them off.
Yeah.
Which it should never have been like that. I don't know why it was really set up that way, but it's really the sanitarians that should be going out and taking the samples, because even though they're private lakes, it's still a public swimming area.
Okay.
So they've been doing that, and following up with them on.
So that would be like Canoe Brook, Pinewood,
Brushwood.
Okay.
Brushwood is the one that was just drained. They were doing some work to it.
Okay. Okay. Because there's no swimming at Twin Brooks, right?
Right.
There used to be. Obviously, that's my pet peeve, and now obviously not. Okay, so they have to continue. So how often do they have to do that during the summer?
So they do that every Monday morning. They take the samples, and then we drive them up to Fairfield Health Department, and they have a state courier that picks them up and brings them up to the state.
Okay.
And then they also offer services on Wednesdays. So we don't typically do it again on a Wednesday unless the Monday sample comes back above the limits.
Okay.
Test the parameters, then we'll go out and test it again.
Okay, so this is a crummy question, but do you know what they check for?
So yeah, so they check for levels of E. coli.
Okay.
It's an indicator organism, so if that's there, then that says, it's not safe to swim if it's at a certain level.
Okay. Okay. Thank you. So that would get back to like the geese and
rain. If there's a significant amount of rain,
okay,
then we just recommend that they just don't swim in it. If I think it's more than 1 or 2 inches, I forget off the top of my head. Then we recommend just not swimming in it at all because of all the runoff. So you'll see high levels after rain. But yeah, geese, anything like that.
Okay. Oh, that's pretty interesting. All righty, thanks. All right. Anything else that you?
I don't think so.
Any questions for Lucy? Anybody have any questions or thoughts? All right. Any new business that anybody would like to bring forward? Any old business anyone would like to bring forward? I don't think I have any. Luce, is there anything that we can do in terms of being supportive or helpful as a board? Do you need us in any way?
No, everything's been going good.
Knock on some wood.
The only thing I would say, if you have any suggestions for these meetings, things that you want to hear about that we're not talking about, because I feel like a lot of times there's just kind of the, I don't know if there's any information that I don't give you that you want, or specific things, you know what I mean? Like we talk about complaints, and we talk about, so by all means, if there's more you want to hear about, please let me know.
All right. Well, everybody can kind of give that some thought. I personally, I just think anything that's unusual, anything that happens that, or any, if a lake gets closed, if like you said, if there's a restaurant that's struggling, I think those are things that would be important to me. But I'll give it some more thought, and I think if we can always go into executive session if you're having struggles with, staff, or if you had any way that, we can be supportive in terms of that. I think we could certainly go into the executive session and, be helpful and supportive to you, whatever. I don't know, I'm off the top of my head, but,
let me know if there's anything, or you want me to be more specific with things, because I just feel like a lot of times I just run through it and just give you general numbers and counts, and it's just like, I don't know if it's really even meaningful, or you know what I mean? So let me know.
Okay. All right. That's good. Well, everybody can kind of give that some thought. All right, then, if there's nothing else, no questions for Lucy, and I guess I'll entertain a motion for adjournment. And Karen, motion, I need a second.
I'll second it.
Allison, Ben, Glenn, I got two. All right. And so all those in favor for adjournment, say aye. Aye. Okay. Thank you. So this is the June meeting. July and August, we don't meet.
Right.
So September is in person in September?
Correct.
Okay. Let's see. And that's on, oops. I know my antique paper calendar. September, that's on September, 9/11. All right, so on September 11th is our next in-person meeting. And we can all send you, I guess, via an email if we think of any other format or anything else we'd like to do in terms of additions of information we're looking for. Everybody have a wonderful, safe, and happy summer. And
you too.
Safe travels. And thank you. Safe travels, and as all the children are moving up a year in school, that's a biggie. My preschool granddaughter's moving up to kindergarten. Allison, yours is moving up to middle school. Glenn, you've got somebody graduating from college?
No, I have my daughter graduating from nurse practitioner school.
Oh, congratulations. Yes. Need those nurse practitioners.
Yes.
All right. We need them. Tell her I'm happy for her. That's terrific. That's terrific. All right. Any other announcements or thoughts? All right. Then I'll adjourn the meeting. Thank you to everyone again, and have a wonderful summer.
You too.
You too.
Have a good summer, everyone.
Bye-bye.
Good night, everyone.
Good night.